The Association of Community Pharmacists within the Federal Capital Territory has decided to change with the times by opening up discussions on enhancing the growth of their practices and businesses through networking. This forms the crux of the maiden edition of a Business Forum Summit organized in Abuja. Health correspondent Kemi Balogun has more.
The role of community pharmacists has continued to evolve greatly, and getting involved in a number of other health initiatives has become more important.
Thank you.
This gathering of community pharmacists is eager to network with various partners in the business world to improve their business and practice. They are doing this through this maiden edition Business Summit to discuss issues surrounding business survival in a crisis environment from the community pharmacist perspective.
It's time for economic survival, and a whole lot of people are not so happy, but they are doing their best to survive. And so the pharmacy world or sphere is not spared from this, particularly when we rely reasonably for most of our imports from outside the country.
You need to survive in the business world and survive as a practitioner as well. So for this business forum, our people will be able to take away the fact that they need to manage their business properly. They need fine lines of business defined. They need to know how to keep their books, how to assess capital, what to do with their capital, and all the rest.
While still highlighting the challenges of dabbling into this new change, they are still confident that seeking for ways to enlarge their coast in other areas through also exploring digitalization will go a long way in enhancing their practice.
Those businesses in Nigeria does not grow because of these guilt-free leakages that is coming from the staff within the system, and that also affects pharmacy practice. Here today, in the course of this business summit, we have brought on board an expert in crime detection.
The larger world out there, there are so many things that are happening that pharmacists need to do review and think about what they need to do in terms of patient care, counseling, coaching, community health, vaccination, stuff like that. They probably also need to look at even traditional medicine. When you go to the digital environment today, pharmacists are not there. And we need to talk about how can they get into this environment.
They are also seeking for government support in utilizing their roles effectively within the healthcare delivery system as they evolve with the times. Kemi Balogun, TVC News, Abuja.